everybody. So this is my week 9 webcam response, discussing the topic of active euthanasia, which thankfully I actually didn't have to do any research on due to my experience in the medical field. So I'm obviously already very familiar with this topic. Now when it comes to active euthanasia, it can become one of those, it can become a very huge ethical issue, of course. My personal view on it is that if someone is in that much pain and they are just ready to meet their maker and they no longer have any desire to be present on earth, they should have the right to ask for active euthanasia, which is also called assisted suicide. Now, typically the cases that I've heard of, it's always been the patient's will. The patient wants to die, the patient is ready to die, and they will ask their physician, "Can you please let me go?" Something along those lines. I personally have never heard of an instance where active euthanasia was done against somebody's, what's the word I'm looking for? Against somebody's wishes or against their will, per se. I've always heard of active euthanasia as being a way to help alleviate the pain of those who have been in chronic pain and are ready to leave this earth. So that's pretty much, and usually as well, active euthanasia is not done in a barbaric way or anything. Through my studying of an LPN school, the excuse me, the examples that my instructor gave me were pretty much like how they end somebody's life when they're on death row. It's just a lethal injection. They don't really feel anything at all. It's just like you're going to sleep and then you never wake up. I've never heard, or at least in modern times, I've never heard of a barbaric or inhumane way of performing active euthanasia on somebody. I personally feel like it is something that should be legal, mainly because if someone is in that much pain, like, you know what I mean? I mean, that's really selfish of us to say, "Oh, that's illegal, you need to suffer." You know, if someone's ready to go, they're ready to go. I actually firsthand experienced that. We had clinicals at one of the local nursing homes, and there was this woman, and she had plenty of health issues. She was pretty much bedridden, and she just never seemed happy. You know, she didn't want to wake up, didn't want to do anything. So my instructor, I witnessed this, I wasn't part of it, but I witnessed it and heard it, but my instructor, you know, got down to the bedside with her and got face to face with her, and she asked, she was like, "Are you ready to meet your maker?" And this lady was like, "As ready as I've ever been." And that just kind of hit me, like, you know, if that woman is in so much pain that she just doesn't want to be here anymore. And I feel like that should just be a right. If you are in so much pain, or you just can't fathom or can't cope with your medical issues, and you know it's not going to get better, just, wouldn't you, if you had been in pain your whole life and you were just ready to go, wouldn't you want someone to respect your wishes and respect what you want if you were to ask, "Can you perform active euthanasia on me?" Because personally, if I were to ever get into that situation where I was ready to meet my maker, I would definitely ask for active euthanasia. I would definitely make the decision for myself. Just because someone is chronically ill or you know, has some sort of condition does not mean that they shouldn't be able to still make their own decisions, even when it comes down to life and death. So that was enough about that one. I could go on all day. But the other one is or the other question is about the issues with doctor prescriptions and the pharmaceutical companies, which as well, with my background in nursing, I am very, very familiar with. And even if someone didn't have any experience in the medical field like I have, it's pretty obvious to see that, the pharmaceutical companies definitely try to sway what type of drugs doctors prescribe. You get the little pens, you see the tissue boxes with the brand name on them, and I don't want to say it's necessarily like a huge issue. Like, it's not like they are asking these doctors to prescribe a certain thing that won't help someone's condition, if that makes any sense, if that correlates at all. I guess in simpler terms, what I'm trying to say is that they're not going to, like, say someone comes in for, let's say, a UTI or bladder infection, and this pharmaceutical company is like, shove Adderall down my throat. It's not like that. But I can see sort of an issue being, I guess, see, I personally, especially being in the field, I don't see too many issues with it, because, the doctors are obviously very knowledgeable when it comes to which medications to prescribe to which conditions. So, regardless how much money the doctor or the pharmaceutical companies pay these doctors in these doctors' offices, they're not going to, what's the word I'm looking for? I'm so sorry. They're not going to, I guess, go back on their own knowledge. If they know that the drug that this company is trying to push through is not going to work for their patient, they're not just going to go ahead and write that prescription because it's more money for their office. Now, when I say that, I don't mean every single office everywhere doesn't do that, because there are probably some doctor's offices and doctors that do that. The main issue when it comes to pharmaceutical companies is money. The doctors could easily give any patient an off-brand name, but those off-brand companies do not pay as handsomely as the big pharmaceutical companies. Yeah, I've never had an issue with it. They'll just have the pens up at the desk, and you sign in, and you're like, oh, just take one, keep it. The way I see it, it's pretty much the same as seeing a TV commercial for some sort of medication. I don't see any harm in it. But that's just me personally. You may see something wrong with it as to where I don't. But then again, while I was in the medical field, I was not the one prescribing, and I was not the one dealing with choosing which medication to go with I was not choosing which medication went with which diagnosis. There it is. But of course I knew what medications treated what, but I was not the one to prescribe. And especially also with my clinical experience in the nursing field, I've never seen anyone get harmed or anyone get out of practice, I guess, due to the whole pharmaceutical companies and prescriptions. It's mainly just, it's money. That's all it is. It's like if you go to Walmart and you see Tylenol, 50 milligrams or whatever, and it's like, 60, and you see the Tylenol, like 100 capsules, 60 milligrams, and it's like $15. But then you look like right under it, and you see acetaminophen, 60 milligrams, and it's like $5. It's the same thing. It's just the brand name. So, along with that, I think this is the point I was trying to make. I'm sorry this is so long, but the only bet I do see in it, though, is that if the companies are trying to push a certain drug, of course they're going to charge more for it due to the brand name. So that is the only harm I could really see in the whole tie with the pharmaceutical companies and the doctors. But then again, if it's a medication that someone's insurance does not cover or someone could not afford, the doctor would still not go through and prescribe it and just be like, oh well, you're going to find a way, because that's, and like I said before, I'm not speaking for all doctors and all doctors' offices, but everyone that I've come in contact with, I've never heard of anything like that. But thank you for listening to me ramble, and I guess leave some feedback in the comments. Thank you.